Okay, this is Unit 2, and we're going to talk about some more parasites. And luckily for you, these are a little bit easier, in my opinion. They have a lot of different characteristics so that you don't get them mixed up as easy. Okay, so the first ones are the platyhelminths or the flatworms. And we're going to start out talking about the trematodes, and these are in the class Trematoda. Okay, you need to know where these are found. The ones that are in the organs are Fasciolopsis, which invades the intestines. Fasciola and Clonorchis invade the liver. Paragonymous, the lung. And then the blood-dwelling are the schistosomes. The schistosoma, if you remember from your analysis, Schistosoma hematobium infects the blood vessels around the bladder, and then there's two other ones that infect the blood vessels in the intestines that we're going to talk about. Okay, so the life cycle. This is a picture that came out of your book, and let's see where it starts. So these eggs are found in feces or in sputum, and somehow they get into fresh water, and they grow and they start to turn into Miracidium or Miracidia. This is the first stage larva, which gets ingested or it penetrates into a snail. So the Miracidia found in water gets into the snail, and the snail is the first intermediate host. Sporocysts will start to develop, that's right here, and then Cercariae, which are second stage larvae that are free swimming, will come out of the snail and are released into the water, and they either get on plants or animals. So here's a fish and here's a crab that they get into, and then the fish or the crabs or crayfish or plants are the second intermediate host, and the Cercariae turn into Metacercariae here, and then this is where patients consume those and get infected. So this PowerPoint is what I just was saying. This is a little summary of that. Okay, the stages, there's three main stages. The eggs, just like what we've talked about in Unit 1, these are the ones that are most often seen in humans. And then there's the larval stage. These look like really small worms, and it's like the kid. It goes from eggs to a little child and then the adult. So the larval stage is in between the eggs and the worms. So the adult worms are dorso-ventrally flattened. They usually have an oral and a ventral sucker that helps them eat. They're hermaphrodite, or not all of them, but some of them are hermaphroditic, which means they can self-fertilize and they don't have to have sexual contact to be productive. They have a simple digestive and intestinal tract, and they absorb and release nutrients and release waste through their body surface. Okay, these are the flukes. This is a flatworm in the trematode family, and the flukes are Fasciolopsis and Fasciola. And the eggs of these two are indistinguishable. So in lab, you just say these are fluke eggs because we can't tell the difference between those. they're indistinguishable, and they have an operculum, and I can't even hardly tell where the operculum is, maybe right here, and that's a cap-like lid that's found. Okay, so the adult worms, you can tell the difference if you find a worm. The adult worms are about 3 centimeters long, and Hepatica has shoulders. So Fasciola hepatica is this one, and it looks like it has shoulders, this being the head, and Buski does not. Fasciolopsis buski does not have shoulders. Okay, so the two worms are Fasciolopsis buski, which is also the giant intestinal fluke, and Hepatica is the sheep liver fluke. And you need to know these common names for your test. Buski lives in the small intestines. It attaches to the intestine, and it can mimic an ulcer. You don't need to know these countries where it's found. That's just kind of extra information. It's found in rabbit, pigs, and dogs. The Hepatica is this sheep liver fluke. The natural host is the sheep, so that's where it gets that name. They live in the bile duct, and they can block the bile duct and cause an obstruction, just like gallstones do. Okay, I don't have a PowerPoint on how they're tested. You use a stool sample, and there is an ENTERA-test or an ELISA method that's available. The patients for these usually have the same kind of symptoms as the other parasites do. Abdominal pain, diarrhea, even constipation, anemia, eosinophilia, fever, headache. The things that I put on the PowerPoint are the things that are unique. And again, like I said with Unit 1, don't just study my PowerPoints. There may be information in your notes that are going to be on the test. Okay, so this one used to be Clonorchis sensuus, but they changed the name in the past like 2 years to Episethorchis. It's also known as the Chinese liver fluke. The egg has an operculum. This is its operculum, and these are its shoulders, and it has a small knob. This one looks like a little rat or something to me. The worm is 2 to 5 centimeters. You can see it with your naked eye, just like the flukes. And it's narrower than in the middle, so it's narrow at each end compared to where it is, how big it is in the center. You don't need to know the countries. This comes from fish. The worms, they grow in the liver, and then they live in the bile duct. Infection causes epigastric discomfort, jaundice, and liver enlargement. Paragonymous westermanni, this is the oriental lung fluke. The egg has an operculum with shoulders, but it doesn't have a tail or a knob like Episethorchis does. It has a terminal thickening. It gets thick right here. The worm is red-brown in color, and it has a cuticle on the outsides of it that you can't see here with tiny spines on it. Paragonymous comes from crayfish or crabs. the flukes are released in the body. They migrate in the intestinal wall. They can go through the peritoneal cavity, through the diaphragm, and into the lungs. So usually the specimen is sputum, not stool, because we don't see these in stool. The patient can have them in the stool if they cough them up and swallow them back down. Pulmonary paragangliosis mimics TB. The patients, on their chest x-ray, it will look like an infiltrate there, and they'll have blood-tinged sputum. Cerebral is when they migrate to the brain, and they'll have decreased motor skills, seizures, and visual difficulties. Okay, the schistosomes. The schistosomas are the blood flukes, and there's 3 that you need to know. Schistosoma mansoni is Mason's fluke. Japonicum is the blood fluke, and hematobium is the bladder fluke. Schistosomiasis ranks second to malaria as a worldwide cause of death, and it infects 200 million people a year, and it's not seen very much at all in our country, but it's in other underdeveloped places. Okay, the eggs, you need to know the eggs and where these spines are. Okay, Mansoni has a large lateral spine, and it infects the intestinal vessels. So this is Mansoni A, and lateral is on the side, so this is Mansoni. Japonicum has a small lateral spine, and this is it, and you can hardly see its spine in a lot of pictures. This one invades the vessels of the intestinal tract, and it's the most severe, and patients have the most eggs. Hematobium has a terminal spine, and this is the one that infects the vessels of the bladder. The worms have separate sexes, and they're rounded in appearance. These can also infect animals. The cercariae penetrate the skin, and the patient will have inflammation at the penetration site. The patient will have abdominal chills, weight loss, bloody diarrhea, painful urination with the hematobium one. The spine of the organism can cause necrosis and obstruction in the bowel or the ureters. The patients have secondary bacterial infections. Schistosoma hematobium can cause nephrotic syndrome, and this is called schistosomiasis, bilharziasis, or swamp fever. So it penetrates the skin. There is also, this last thing says swimmer's itch. This is when they penetrate the patient's skin, and it causes an allergic reaction to the patient. Okay, these are the nematodes, or the roundworms, and these are in the class Trematoda. These have the 3 eggs, larvae, and worm stages, and these are just some definitions that you need to know. The buccal capsule or cavity is like their mouth. The chitin or the shell is a nitrogen-containing polysaccharide coating that's seen in Ascaris eggs. Copulation is a sexual union. Copulatory bursa is a structure found in the male that is umbrella-like, that aids in copulation. Gravid means that the worm is pregnant. A retroinfection is when the worms can travel into the body and lay more eggs, and those mature into adults and they lay more eggs, and the cycle just continues. An auto reinfection is when the patient infects themselves. The example is the pinworms that get on the outside of the anus, and the patients, because it itches, the patients may scratch it and transfer it to their mouth or somewhere else. Corticated is the outer mammulated albuminous coating seen in Ascaris. Embryonated means that the egg's fertilized, and unembryonated means that it's not. Okay, Anaerobius vermicularis. This is the common name is pinworm, and these are seen in our country. The egg is over here. It's flattened on one side, and it has a double layered shell around it. And in the worm has a pointed tail that looks like a pinhead, and that's where it gets its name. The humans are the only host that's been seen. Patients will get these, and they travel outside of the anus and lay eggs, and this is usually seen in kids, and they itch and they scratch them, and they can get in the bed sheets and infect other people in their family. The eggs can survive several days to weeks. The patients can have a retroinfection or an auto reinfection, and the procedure to diagnose this is the cellophane tape procedure, and this is it's recommended for the parent to collect this before the child wakes. And what they do is take a piece of tape, a clear tape, and stick it to the child's anus, and then bring that piece of tape to the lab, and we look for the eggs. At night, the females will go on the outside of the anus, and they can lay up to 15,000 eggs. Usually the patients will spread it to other members of the family. So usually if one child has it, then the whole family will be treated. So the patients have itching, inflammation in the anal and the vagina if they get there, nausea, vomiting. Little kids are irritable, and they have sleeping problems, and they may have ulcers and inflammation. The family may be all treated, and everything needs to be thoroughly clean. The sheets, the bedding, everything. The patient's clothes. Okay, the next one is Trichuris trichuria, or the whipworm. The whipworm has a long curly tail that is supposed to make it look like a whip. And this is seen with the naked eye. It's 2.5 to 5 centimeters. The egg is shaped like a football or a barrel. So it has 2 polar plugs on the ends, and it's usually yellow-brown in color. The males are the ones that have the prominent tail. The eggs are ingested. They go to the intestines and can live for 4 to 8 years. It's found where human feces is used as a fertilizer, and it's found in the southern United States. Diagnosis, the zinc flotation makes the eggs more easy to see. If a patient is treated, then it will distort the eggs, and this can happen with any of the parasites. If the patient is treated, then it could damage the eggs so we can't see them well. Diagnosis, trichuriasis or whipworm infection. The patients will have 500 to 5,000 worms. They can have dysentery, which is chronic diarrhea, severe anemia. In patients, in kids, they can have growth retardation, rectal prolapse. This mimics inflammatory bowel disease, and oftentimes patients have Ascaris, which is the next organism we're going to talk about, along with Trichuris. Okay, Ascaris lumbricoides, the common name is large intestinal roundworm. This is the egg, well, these are both eggs. This one is corticated with the nitrogen polysaccharide coating around it, and this one is not corticated, but they're both Ascaris. They're usually oblong. This is a fertilized egg, and it's usually rounder, and it has a thick shell of chitin. The worms are really big. The female can be up to 35 and is thick like a pencil lead, and the males can go up to 20, and they have a curved tail. This is the most common intestinal helminth in the world, and it's the second in the United States after the pinworm, and it's been seen in the Appalachian Mountains. They like warm climates and usually are seen in children. The eggs are ingested and they travel to the intestines. They can travel to the lungs, and the patients could cough them up and swallow them, and they can get back into the intestines. The patients may be asymptomatic if they only have a few worms. In ascariasis, the worms may cause tissue damage when they're migrating from the different body areas. Patients may have abdominal pain, fever, vomiting, distension. Mature worms can tangle themselves up, causing obstructions in the intestine, the appendix, liver, bile duct, and they can even cause death. And there are some really horrible pictures of how these worms can tangle up in the intestines, especially if you want to Google that. They can migrate to the lungs to cause pneumonia. Secondary infections can occur at the site of penetration, where the site it becomes infected. Okay, the hookworms. There's two hookworms, Necator americanus, which is the New World hookworm, and Aclystoma duodenale, which is the old hookworm. With the eggs, they have a little bit of size difference. Aclystoma is a little smaller than Necator, but other than that, they're almost indistinguishable. So in lab, you are to report these as hookworm eggs. They have 2, 4, or 8 cell stage embryonic cleavage, which are these cells in here. The rhabditiform larvae are newly hatched worms. They're really small. They're the actively feeding larvae, and they have a buccal cavity, which is their mouth, that's used to identify those. The falciform larva is the infective non-feeding falciform larva. They're slender, they have a shorter esophagus than Strongyloides, and they have a distinct pointed tail. This is what the falciform larva, no, this is the adult worm. I don't have the falciform larva. The adult worms have a hook like this one. That's where it gets its name. These are the buccal cavities of the worms. Necator has cutting plates, and Aclystoma has teeth. So this is Aclystoma with the teeth, and these are the cutting plates. They're just not as sharp, and they're shorter than the teeth are. You can't tell the difference. You have to have the buccal cavity to identify them, so we call them hookworm eggs. A fourth of the world's population is said to be infected, and they're found all over the world in poor sanitation areas. Humans contract this falciparum larva through their skin, especially their feet. This is the worm. I don't know if you all were told, but my parents always told me not to stand in the mud puddle with no shoes on because worms would go up my feet. And this is what they were talking about. They can migrate to the lungs and be coughed up. These worms can lay 10,000 to 30,000 eggs a day. Most patients have light infection and they only have a little bit of weight loss and anemia. The patients can have an intense allergic reaction at the site where the organism went in, and this is called ground itch. They also will have sore throat, bloody sputum, and mild pneumonia. Acute infections, they have more than 5,000 eggs per gram of feces. That's a lot. These patients will have or usually develop microcytic hyperchromic anemia and hyperproteinemia. Okay, Strongyloides stercoralis. The eggs look a lot like the hookworms and they're hard to identify. Usually the way is the size. They have a 2-4-8 cell stage. The radidiform larva is the active feeding. You identify it by its buccal cavity. The falciparum larva is the one that infects the human. And what you need to know about this is it has a notched tail. And you can't see that really in these pictures, but this is the way that this one is identified. In the adult, only females have been described, and these are parthenogenic, and that means that they don't need a male to reproduce. Also, the common name of this is the threadworm. Okay, the zinc sulfate is the best way to identify these. There's also INRA test, and sputum can be done if the patient coughs them up and they're in their lungs. Strongyloidasis, or the threadworm infections. The most common is diarrhea and abdominal pain. They can have malabsorption, which is seen in heavy infections, and they have itching and allergic reactions, and they can travel to the lungs. Okay, Trichinella spiralis is also known as the trichina worm. These have only 2 stages that you need to know: the encysted larva and the adult worm. The encysted larva is up to 1 milliliter, and it's found in striated muscles coiled up in cells. So this is it in here, and it's inside of a cell, and it makes an infiltrate around the cell. The worm is blunt. The female has a blunt round end, and the male has a curved posterior with 2 rounded appendages. It's found in meat eaters like pigs, walruses, rats, and bears. These are resistant to cold temperatures, and humans get this from usually pork, and they travel to the through the intestine and into the muscle and get into our muscle cells and form a little cyst. It starts to have an infiltrate, a granuloma forms and becomes calcified, and because it we're not the normal host, it will eventually just die. Diagnosis, since this goes to the muscle and not the stool, then we have to examine the infected skeletal muscle. The muscle enzymes like LDH, the lactate dehydrogenase, aldolase, and creatine kinase are all elevated. This has been said to be called the great imitator because it looks like the flu and all kinds of other illnesses, and it's just hard to diagnose. The patients will have pain in the pleural area whenever the worm is traveling, and there's no treatment. They just treat the symptoms. And we're going to stop right there and continue with filariasis.